Same settings I have on your sheet. So there's our radial tip, and now watch my hand motion. It's just, kind of going back and forth. It's real simple. But the one would be underneath your tissue level. This is a furcation. I want to get into that furcation. The neat part about the radial tip, those explosions are going into the furcation. Now I get the epithelialize under the tissue too. You'll see. So I'm just painting. I go right down the bone though. And again, real light pressure on this. Real light pressure. I'm not dragging anything through any of it. So you look at my flap pulling back. See that? How nice that is? So you can see right in there. And I do the linguals too. It's just harder to film the linguals. The loop cam's actually on my loops. But now I'm de-epithelializing on that papilla. You see the outside of the papilla. Now if you put too much laser energy in here when you did your first pass from your Nd:YAG, you lose all those papillas. All the tissue will just fall right off of it. Have I done it before? Yeah. Luckily it's in the posterior areas. But when this is that edematous, you're going to have that problem because again your Nd:YAG loves that. Okay, so now we've done everything. We've gone in there, took the smear layer off. We've gone in and take the calculus off. We took the epithelium out. We de-epithelialized. Now the next thing is, do we have enough blood in the sulcus to create a clot? No. Hold on, I'm not done yet. So we want to create a clot with these settings, and this is your last setting, your Nd:YAG, 20 hertz. VLP is your 650 microsecond pulse, okay? And you're going to use it at 3.5 watts up to 4 watts. Now this one should never go above 4 watts. Whenever you do a clot, I don't care what fiber you're using, never go above 4 watts. You don't need to do that. And you want the blood to turn magenta but not black. So those are my settings. Again, turn your timer off. So if you don't have bleeding, then you can use an Endo Explorer, end firing erbium tip, piezo cavitron tip. You're going to penetrate the base of the pocket, decorticate the bone, and open up the PDL. Okay. You're going right into bone. Then you're going to take your laser, aiming at the base of the pocket, turn on the laser, and slowly withdraw it. And as you slowly withdraw it, it starts to form a clot. Okay. The blood's going to get darker and stickier. You're done. You're done. You don't need to do any more than that. What this fiber do, it seals the pocket, creates a lattice for reattachment. If you're going to do bone grafting, which I'm going to go over in a couple minutes, you're going to do it after you create your clot. Don't put your PRF in there and then put your laser in. You just cooked it. In fact, Myron is kind of hesitant to even create a clot because the whole thing about sticky bone is creating a clot with that. But you do want to create a clot. I've done that. Then you want to reapproximate the tissue with gentle pressure. Remember, Eli said don't put a lot of pressure because you want to create that space for regeneration. If you plaster everything real tight, which you won't. But, and then if you want to seal it with tissue glue, you do so. If you don't, you don't. It's up to you. So this is step 5. So I'm going in there, so I do have blood. I said, okay, so you're going to create a little, but look how fast I am. I'm really quick with this because this is on 6.5 times longer. You don't want to burn anything. If you leave it in there like removing epithelium, you won't have any epithelium left. Okay. And there's my assistant just putting gentle pressure on it. Now the hardest part is getting your assistant's suction out of there. Because what they forget what you're doing and they're not paying attention, they'll pull your clot right out. So make sure your assistant doesn't have their suction in there. Okay. And that's pretty much your clot. Okay. Remember, that creates so much heat that if there's any bacteria, the bacteria is all dead now. That's
What happens if the patient has a metal crown?
You gotta be careful. It may
Sparks.
spark, it may spark. Well, I'm joking, I'm not joking, I said,
Yeah.
just be careful, if it sparks, it's okay. I mean,
Okay.
if it's an amalgam restoration, which is not a whole lot of amalgam out there, it will cause it to really arc. Yeah, but luckily there's not that much amalgam out there anymore. Okay, now watch this though. You asked me why I use period. Watch right here. See the tissue's loose right there? And I take my mirror handle and just push it in. I'm gonna seal it. And let it sit for like 10 seconds. When I take it off, the tissue stays in place. Okay, that's why I use that. And see how I cut the tip of that? Yeah. See how it's dry? That's how you use your period. So in this case, I won't use sutures. Now, I do use periodontal packing in the back areas because the patient forgets I did the procedure. You know, day 3 doesn't hurt. They go out for a couple cocktails. They're kind of feeling really great, and they have munchies, and they guess where they're munching? Right on my surgical site. That can't sustain chewing on it yet. You know, you don't have it. You know, all you have is a clock. You'll get everything off. You'll be pulling out pieces of meat, you know, whatever, chips. And people,